All right, hello, future CNAs. If you're getting ready for the big exam, you have come to the right place. We are going to break down everything you need to know so you can walk in there feeling totally confident and, walk out certified. Okay, so here's what we've got on tap. First, we'll cover what the CNA exam even is. Then we'll get into its two-part challenge. After that, and this is the fun part, we're going to try out some real sample questions. And finally, we'll talk about the best way to prep so you can nail it on your first go. All right, let's dive right in. First things first, what is this exam all about? The easiest way to think about the CNA exam is as a safety check. Seriously, it's not about just spitting back facts you've memorized. It's there to prove two super critical things. One, that you actually understand the why behind safe patient care, and two, that you can physically do the skills correctly when it counts. It's really where the book smarts meet the real world. And because it's all about theory and practice, that leads us right into how the exam is set up. It's basically a two-part challenge where you have to show you've got both sides covered. So you've got two halves of a whole here. On one side, you have the knowledge exam. That's your standard multiple-choice test on all the core ideas. On the other side, you've got the clinical skills evaluation. This is a hands-on test where someone is literally watching you perform key nursing tasks. And listen, this is so important. You have to pass both. You can't just kill it on the written test to make up for messing up a skill. It doesn't work that way. Both are a must-pass. And when we talk about the knowledge part, we're really talking about the bread and butter of the job. Things like your roles and responsibilities, safety and infection control, which is huge, personal care skills, basic nursing measurements, and of course, psychosocial care and resident rights. These aren't just random trivia for an exam, right? This is the stuff you'll be doing and thinking about every single day. It's the foundation of being a great, safe, and compassionate CNA. All right, that's enough background. How about we try a few of these questions out? Let's get a feel for what you'll actually be up against. Okay, question number 1. Picture this. Your hands are visibly soiled. What is the very first thing you do for proper hand hygiene? Is it A, wet your hands with warm water? B, grab some alcohol-based sanitizer? C, put on clean gloves? Or D, turn off the faucet? Take a second. What's your gut tell you? And the answer is A, wet hands with warm water. I know it sounds super basic, but it points to a really critical safety rule. If you can see dirt on your hands, hand sanitizer isn't going to cut it. You have to wash them. And that process always starts with getting them wet, before you even think about soap. Okay, ready for another one? Here we go. What's the normal adult oral temperature range in Celsius? Is it A, 34 to 35, B, 36.5 to 37.5, C, 38.5 to 39.5, or D, 35.5 to 36.0? This is one of those numbers you just gotta know. If you picked B, 36.5 to 37.5, you got it. And this is why it matters. Knowing these vital sign ranges isn't just for the test. It's absolutely non-negotiable in the real world. This is how you spot the very first hint that a resident's health might be heading in the wrong direction. All right, last one for our little demo. When you're moving a resident from their bed to a wheelchair, which of these devices is meant to reduce strain and stop injuries? A, a pillow, B, a bed sheet, C, a transfer belt, or D, an overbed table? And the answer is C, the transfer belt. This is a perfect example of what the exam is all about. It's making sure you know how to use the right tool for the job to keep everyone, that means you and the resident, safe. Okay, so now that you've seen what the questions are like, you're probably thinking, how on earth do I prepare for all of this, right? What's the smartest way to get ready? I mean, you've got hundreds of possible questions, plus that whole hands-on skills part. How do you master it all? Well, the answer is simple. You practice like you play. The absolute best way to prepare is to use practice tests that feel just like the real deal. Same timing, same format, even a little bit of that same pressure. And that's exactly where a resource like certificationexam.com comes in. They've got two amazing tools to help you out. There's an online web simulator that lets you practice with over 300 questions in a timed environment, so it feels super realistic. And they have a mobile app, which is a game changer because you can study and take practice tests literally anywhere, even if you're offline. Look, using tools like their online simulator and the mobile app, it's about so much more than just memorizing answers. It's about building real confidence, the kind of confidence you get when you're truly prepared. This is how you make studying second nature. So when you walk into that exam, you're ready to pass. No question about it. First time.